My name is Geoffrey Juma. I'm the project lead of Afya Njema Haki ya Jamii project being implemented by the National Taxpayer Association funded by the Christian Aid. Today we are at Noble Hotel. We had a 2-day workshop where we convened the CSOs from Nandi. We were discussing issues on budget analysis with a focus on the healthcare budget. We found out there's a need for the CSOs to be well equipped with these documents. And the knowledge they gain from this workshop, they can cascade it down back to the community. We are joined by the SEC Finance, together with the Chair Health Committee. And we also joined by the Finance Chair Health Committee, where we had a plenary session between the CSOs and the duty bearers. The session was so remarkable, where the CSOs were able to voice out their concerns, some of the underlying issues the community is facing. And the CSO also underscored the essence of the CSOs working together with the county assembly, working together with the executive, so that they can impact more on the civic education, the budget process, in regards to the health sector.
Okay, my name is Hilary Serem, the CC member for Finance, Nandi. Today we have had an engagement with the NTA as the capacity build on the civil society organization in Nandi, particularly the youth. We appreciate what they have done in building capacity for this team, training them on the entire cycle of the budget and how they plug in ensuring that our documents, the statutory documents, the budgetary documents, actually they comply with the legal requirements and actually that they meet the needs of the people of Nandi. We welcome this kind of engagement, this kind of empowerment and capacity building for the civil society networks. In Nandi, we have a new awakening where we are collaborating with these teams, calling them for stakeholder engagements, the civil society networks, the Chamber of Commerce, and all the stakeholders, the county assembly, and so forth. Whatever documents we do, whatever statutory documents we do, the budget documents, we engage. It's their rightful duty as first the citizens of Kenya to be engaged through public participation. It's a requirement in the Constitution. And the only way we can get to reach the people and to enrich our documents is to have people who are willing, people who are enlightened, and people who take time, who put effort in turning up to the forums and giving meaningful contributions to enrich the processes and the documents that the counties and the governments do. And what NTA has done is actually to align this, to bring these people together, to empower them, to talk to them, to train them, to capacity build. And going into the future, we actually going to have a very enriched and a very impactful civil society network. We thank you once again and we appreciate. As on behalf of the Treasury of the Nandi County, we pledge our support and we pledge our cooperation and your engagement as we go forward. Collectively, as a people in Kenya, as a people of Kenya, we must stand up to give that input, to give that very, very necessary contribution as to how and when and who will do and conduct the service delivery for the people of Kenya.
Siku ya leo tumekuwa na mjadala na CSOs na other organizations aswa kwa mambo ya budget at county government, mambo ya health kwa county government na vitu vingine, kwa sababu sisi kama county assembly tuko na jukumu ya kuhakikisha kuwa budget imekuwa implemented to the letter. And the biggest concern that we were having here today was matters that touches on health sector and collaboration with other stakeholders, more so the CSOs and other non-governmental organizations. We know we have so many challenges on the health sector. but not limited to matters on service delivery. But today we came here to discuss on those issues that touches on those health sector. As we speak, we are on the budget circle. Already we have the CFSP at the assembly, which is being discussed at the committee level, which will later be tabled at the assembly for deliberation. We have challenges on ceilings, on wage bill, and other challenges. So today we were here to highlight quite a number of things that will assist us going forward. And we must thank the National Taxpayers Association for this kind of organization. If we have frequent discussion with them, it becomes easy for us as the county assembly and the county governments to deliberate on matters that touches on every sector, and more so the health sector. The issue of operationalization of most of these facilities, it's not limited only to some small factors. We have issues to do with personnel being available for deployment to those facilities. And when we talk of personnel, it means now we have to engage the payroll to ensure that these people are employed at the county government. And that is one of the things that is becoming a thorn in the flesh, not only in the Nandi county government, across all other counties. We have issues on wage bill. And those are some of the things that we are trying to address going forward. So for a facility to be open, it requires personnel, it requires equipment. And it's the same budget that all of us are looking into. That's why going forward, we are trying as County Assembly of Nandi to ensure that we are moving from brick and mortar side that we'll be budgeting for operationalization, equipping and running of these facilities to ensure that the money that was allocated for, because all monies is from Mwananchi, we want to ensure that each and every coin that has been budgeted for is prudently used, and to ensure that the public are well satisfied with the money that has been allocated to a particular facility. On the case of it's not about misplaced priority. Those are things that were seen by previous leaders that they were important at that particular time. But as we go forward, we see that there are some things that need to be put on the side to ensure that we run those ones that are already in existence. That's why I'm saying we are moving from brick and mortar to operationalization and maybe equipping of those specific facilities. Public participation is a critical part, and it's provided for in the Constitution. And I think for proper management and proper leadership, public participation is important, because those are the people we are serving. So we need to get their views on what they are feeling. We are moving to a situation whereby we are having what we call open governance. So we need to get the actual information from the public, and that's why we are saying this public participation is crucial. And going forward, we need to expand even more on matters of public participation. We need to make the public know that this public participation is their own. They need to be there when a discussion is being made. When a decision is being made, the public should be there for decisions to be made in budget and even in whichever the document that is placed at the county assembly. These people should be there to ensure that we move together to avoid complaints back and forth in terms of decision making at the county governments. Thank you so much for having us here, and I appreciate the NTA for this kind of organization. And we are still challenging any other organization that is there to come on board so that we have a discussion that will assist us in prudent use of resources at the county and even at the national government. Thank you so much. God bless you.
So my name is Jacob Sanga. I'm from Tindred sub-county in Nandi County, from an organization called Underit Youth Group. Today we had an insightful day, a training by NTA. The training was all about the budget making processes, the circles that the budget undergoes. Mainly we focus at the county government processes, and today I want to confirm that personally I've learned about the processes that are involved. One good thing that we learned today as participants also, among other things, is that of all the stages of the budget implementation, be it formulation, implementation, monitoring and evaluation, and auditing, and also approval, also requires citizens to participate, and that was a take-home message that we are going to take back to our community. As much as we want to say that the governments are not doing what they are doing correctly, but also we are involved as citizens. The other thing that also we've learned today was about the budget analysis, which we have been taken through, the parameters that we consider when we analyze the budgets and see, looking backwards, what the county government, or rather what the government has been doing over the last 2 or so years, and what they are happening now, and again what they expect to do to get going forward. The other thing that we've learned is the aspect of county revenue allocation. We know some money comes from national government, and we have other source revenue. And what we've realized in today's discussion is that it is very hard for the county governments to fulfill what they had budgeted for in their own source revenue. For example, we were looking at an example where we are seeing by this quarter, that is almost the third quarter, our county, for example, had collected close to 10% of what they had projected for, and that will have a negative impact in our budgeting, or rather the services that the county government has planned to do that. And I think the knowledge that we have gained, we want to say thank you to NTA for taking up the mantle and also train us, and we want to promise that we are going to take the same to our communities back at home, so that they are also informed. We really wish that NTA continue doing the same program, so that they reach a number of people, so that all of us can be informed. We know currently we are grappling with the aspect of corruption in our country, and it is through such processes that even a community doesn't know. For example, if they are building an ECD in their community, they don't know how much is it costing. We therefore want people to get informed, so that then they can assist, for example, the Auditor Generals in monitoring, or rather auditing the projects at the ground. We know the Auditor General has been doing a very good work, but then we want to ask the community to support what she's doing and the team of Auditor General, so that also we as citizens, we understand that we have a responsibility. As much as we ask for our rights, we should also know that we also have a responsibility to keep the duty bearer at hand, or rather keep on checking, because we as the right holders, we give them our responsibility. We give them to go and represent us either in national government or in county government, and therefore we are also obliged to make sure that they do what we told them to do especially during campaign period. This is the confession that we want to wish NTA can take it forward, so that then the gaps that we have realized today, for example, the ones on source revenue, can be amplified, so that then the counties can be cautious, or rather be cautious on how they spend the resources that it is taxpayers' money. Actually, it is from the conversation that we've also enhanced the fact that government doesn't have money. It is from the taxes that they collect, and therefore we have a responsibility. Also, they have a responsibility to spend well that money, and by so doing is by when people understand what is provided for. The other thing is that we also discuss the law. The laws that are also guiding this. One of the law that we've discussed is the Constitution, and the other one is PFM Act of 2012, and that is very good if we do these things from the point of view. Therefore, we will not be contradicting to anyone, because we will be actually following what the law says. Lastly, I want to ask the duty bearers that are being tasked with the responsibility of utilizing, or rather implementing projects that are public funds, that we expect them to follow the law. That is what we are saying as a team now, that let them follow what the law says, so that then if things goes wrong, then they will be liable, because the law is very clear. If they say, for example, you table a document in the county assembly by 14th of February, let that one be observed, so that then we are not caught up by time. Thank you.
My name is Moses Abraham Koga Odera. I come from Tindret sub-county, from Chemal Chemase ward, Nandi County. I represent a communal center for peace and justice, Nandi County. as one of the committee and one of the members of the CSO, I happened to attend this workshop of today, which took place today and tomorrow, and sponsored by NTA. I really came and have really learned a lot. As we started in the morning, the objectives, and some of the major objectives are in line with the county government requirements. And really it has awakened some of the areas which we had not known properly as the CSOs, and has really made us improve, or which I believe tomorrow as we leave, we shall be able to get more and know more of what is required of us when we go back. Today, what made me to be more happy and also improved my information and knowledge is the budget analysis and the time frame for the budget. The facilitator whom they brought was very effective, a person who knows what is supposed to be done, and he really brought it out, the budget analysis, the budget process, and what is required of the CSOs to do were areas that they had not known properly as regards the budget process and the budget analysis. We came also to learn on how the public participation is to be held during the county government public participation time, when they bring those activities in those ward level, from the ward level to the sub-county level. Thank you for having brought the NTA, for having brought us to know more of what is supposed to be done. What I would like to encourage the NTA, they should continue, give more knowledge and skills on the effectiveness of the CSOs and the role they need to play in their each and every sub-county and also the wards, for the people and at the grassroots to be putting the county government on toes on the project development and also the each and every budget analysis that is being done by the county. When they bring, people should be able to know and aware of what is required of them to do, of which I know when we shall leave this place tomorrow, what the NTA has done is going to make us proud of what we have gained, because we are going to do what is required of us at the CSO. Thank you very much.
My name is Sharon Cheruto from Nandi County, from the Nandi County Civil Society Network, an organization called Arise Nandi Empowerment Initiative. So today, for 2 days, we are having an event organized by the National Taxpayers Association that has been so far quite fruitful, and we are grateful for NTA for organizing and to give us capacity or to enhance our advocacy skills. We looked at the budget cycle, which is what we interact with every day, but today it was with a touch of focus on health financing. We were looking at, we looked at 3 financial years, 3 previous financial years, watching or analyzing the trend of what has been allocated to the health sector. We looked at the percentages, or the percentage it forms on the whole budget of the county, what forms, how much goes to development expenditure, how much goes to recurrent expenditure. So we looked at all those breakdowns and how it has been, the trend, how it has been going. So we would also ask questions on why the trends, and this was with the aim of helping us better our voices in advocating for transparency in financing in the health sector. So that was the main objective. We went through the 4 stages of the budget making process: the formulation, the implementation, there is the audit process, and there's also the approval the approval stage comes just right after the formulation. We looked at the several actors in those stages, like in the formulation, the executive, the approval, the county assembly and the citizens, and the implementation, which is also the citizens and the executive, and the audit process, where the citizen is also there working with the Office of the Auditor General. So the highlight here was to remind us also that in each one of these stages, the citizen is actively involved. There's no point at which the citizen is not involved. And it is at this point that we need a knowledgeable citizen who understands what should happen so that they can advocate or they can raise their voice on what can be done better in health financing. So at the end of the day, we had asked ourselves several questions, looked at the gaps or the points at which we could raise our voices and eliminate any malpractices, or just to ensure that the citizen fully participates in this process. The other thing that we also looked at in the process are the legal frameworks, which is very important for a citizen to understand what is involved in the legal framework. The Constitution of Kenya, the Public Finance Management Act of 2012, the Public Finance Management Regulations of 2015, and any other legislation that covers the budget making process. But today we were really having a focus on the health sector, and it has been quite interactive, fruitful, and we have gained a lot of skill today. So we are quite grateful for the two-day interaction that the National Taxpayers Association organized.
My name is Emmanuel Kongin. I was the facilitator for the training of Nandi Civil Society on the health budget and analysis of the health budget for the last 3 financial years for Nandi County. I found that the participants were very receptive to the information. I was surprised, especially with the civil society members who, some of them, especially the ones who are a bit senior in age, they have a lot of information, they shared a lot of information, they were very willing to learn. And I think the balance in terms of the selection of the participants was very strategic. We had young people just post-campus all the way to former retired citizens who have been in the field for long. The training, for me, I think I found it to be quite informative. As much as I was the facilitator, I was also able to learn a lot from the participants. They had a lot of interest and knowledge on health matters and the health budget, and we were able to interact the budget for Nandi County, including the current budget that is being implemented. I think also the approach of having the second day to have a conversation with both the county executive. We had the CC member for for finance joining us, and we also had the chair for the health committee in the county assembly, as well as the finance committee chair. So I think the interaction between the members of the civil society and both arms of government will go a long way in ensuring the success of the program done by NTA on the health sector. So my expectation is that this two-day session will not just be used for purposes of the civil society members to learn, but is also was very, very timely in terms of bringing both the county assembly and the county assembly and the county executive together to listen to the issues and challenges that the citizens are facing around the health sector. So my expectation is that the new forged partnerships between both arms of government and civil society will go a long way in ensuring that there is service delivery and the citizens will get value for the taxes they pay.